Welcome back to the show. Great topic to talk about today with our guest that we just love having her on. She's one of our local experts here. She is Dr. Nathalie Beauchamp. We're talking about the importance of sleep today, and this is something a lot of us, I don't think, pay enough attention to, right?
Yeah. No.
Let's talk about, first of all, the importance of sleep. How much sleep should we be getting?
Well, let me throw a couple stats here, I think, that are important to put things in perspective. 3.3 million Canadians have problem getting asleep and staying asleep. So that's about 1 person in 7. The other interesting stat is 80% of North Americans feel that they cannot be successful in their work and sleep enough. So
I'm not surprised.
You're not surprised about that,
No, because that's what I think. That's what keeps people up at night and creates problems in our sleep patterns, because we're either working too much, or we're stressed about work, so we're not sleeping.
Yeah.
Exactly,
right?
and we're going to talk about some strategy on that. 75% of Americans and Canadian statistics are pretty similar. Report experiencing daytime sleepiness, and then 34% say that it really affects their work, that they're falling asleep. And we have to think most of us are working sitting all day, so you know, that alone is a problem.
Well, yeah, it's almost like when 2, 3 o'clock in the afternoon rolls around for a lot of people, that you get that crash. I mean, I'm part of that 75%. I get sleepy in the afternoon.
So,
for sure.
Nathalie, what actually puts us in that category? I mean, people might be at home thinking, oh, well, I get 5 hours. Is that enough? I get, you know, how many? Is it true that you really need 8? Because
they say 7 to 9, but I mean, I've been in practice for 15 years, and that's a question I ask often to my patients. So I do agree that some people need less sleep than others, but the main thing is if you get up and you're not energized and you're tired, well, then you really want to start looking into that.
Right there.
The other thing, too, that I'm going to discuss as well, but the best hours to sleep are from 10 p.m. to 6 a.m. And the best hours to have your body recuperate, if you want, are said to be 11 p.m. to 1 p.m. That's when your organs kind of... So, as a joke...
before then, you're saying? Make sure you try and be asleep before...
Exactly. And if my segment is too boring today, I brought you a pillow there.
Well, thank you very much. I'm just going to go right back here.
And go over here. Remind me to talk about that, because that's very important. I know the
Let's start off with talking about the symptoms. You gave us a couple.
Yeah.
Let's talk about some specific symptoms.
Well, daytime, hard time to concentrating or being focused, grumpiness. You know, you're just I'm edgy today because I really don't have the patience. But even heartburn, constipation, all these things can be signs and symptoms that your body is not getting the rest that it needs. Because we have to think that it's at night that growth hormones are being produced for repair. It's at night that the cortisol level rebalance. It's at night that we secrete tryptophan from the pineal gland to change into serotonin and melatonin and so forth. So there's a whole process that's happening. And if we're missing that component, we're really missing. So.